when lives are on the line.
Are there any obvious injuries?
These men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC truck.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The two Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof.
Oh yeah. He's got a big cut to his head.
5 million people rely on them
She's absolutely locked in. Okay, good.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
He's been run over by his own lorry.
So it's gone over him properly, all the way.
It went right all at top of it. Wheels in touch with it.
So we think he's got a chest injury, possibly fractured pelvis and some lower limb fractures as well.
The matter, I can't breathe.
High risks.
We've just been tasked to a motorcycle RTC.
That traffic's been stopped there, look.
What happened?
You've come off your motorbike. Anybody not happy? Ready, brace, roll.
And high drama.
What is it? Cardiac arrest, mate. Young cardiac arrest. 27.
Oh, Jesus. So that's the leisure centre directly ahead.
25 stone, maybe this could be a nightmare airway, so we'll draw up drugs on the scene.
So this is emergency anaesthetic in the street. It is a bit risky, but it's what he needs.
Are there any chemicals or other hazards? Is there anything leaking or anything like that?
I don't know.
At Air Ambulance HQ, there are reports of a bizarre accident.
He's been run over by his own lorry.
Any obvious injuries?
She thinks he banged his head.
It's a case for Helimed 99.
Getting out from scene. Roger, Roger. They just think he's been run over by his own milk truck.
Let's go to V12 departure over there and we'll get going, shall we?
Yeah.
Pilot Owen is flying his medics 30 miles to the scene of the accident.
Okay, I'm not video now, that's clear, that's clear.
Dr. Brian is on the team with paramedics Pete Rhodes and Pete Valance. All they know is the information they overheard on the 999.
It's come in from a caller who's gone back to the house to phone the ambulance service, and it's just reported that someone's been run over by a truck.
They're racing towards the Pennine town of Keighley.
You see you've got the high ground beyond the town, You've got the area of moorland. Bradley's basically the other side of that moorland. Roger.
They're circling a line of terraced houses on a steep hillside.
Is it in the village itself, is it?
It's looking like...
down here now at 3 o'clock, I believe, where these caravans are.
Roger.
Just beyond that.
Oh, yeah, I've got the
yeah.
DC police car.
Yeah, okay, you
This
look
little
at the caravan.
farmstead.
The team must get up to speed quickly, with a briefing from ground paramedics.
We've got a 57-year-old gentleman called Peter, milkman. Look, these little low-bedded van. He's gone up, slow down slow.
Peter Brame is lucky to be alive. He's been in the ambulance 10 minutes now.
Hi guys, how are we doing?
A bit tight for space.
Yeah.
He's been crushed by his truck. With a full load, it weighs more than 2 tons.
Did it run over you?
Yeah.
What did it go over?
It went right all at top of me. Wheels in touch with it.
Right. But did the wheels go over your body?
No.
But it's feared the underside of the vehicle crushed Peter's torso as it rolled downhill. He'd got out to deliver his bottles.
He was laid in front of his van, sort of pushing himself up off floor a little bit, and then, I got out. He wasn't really talking, so I've knocked on this house door over here, rung an ambulance, and then, that's it.
Brian wants to identify Peter's injuries. They're internal and hard to spot.
Can you give me a big cough? Big cough. What hurts?
Everything.
When you cough in your chest, does it hurt?
Yeah.
Whereabouts?
All over.
Okay.
Does he have any tenderness around the pelvis, or is it just the mechanism and that bruising?
Just give us an arm a moment, Peter, thank you, fella.
It's feared his pelvis is broken. They're going to fit a tight binder around it. Brian knows that understanding what happened is key to treating his patient.
It's come backwards?
Yeah, it come backwards. And the guy who was first on scene basically said that he wrenched the handbrake up one notch.
And was he still under it?
No, he was in front.
So it's gone over him properly, all the way, hasn't it?
I suspect it has maybe.
Yeah,
Because otherwise he'd have been laid.
Otherwise he'd be dead?
Yeah.
Okay.
We think that this his milk float was up there in that slope and he was behind it. And something's happened now, the handbrakes failed, but the whole thing has gone over the top of him and he's been underneath, but been very lucky not to have been crushed by the wheels. But the clearance isn't that much, so we think he's got a chest injury, possibly fractured pelvis and some lower limb fractures as well. So what we're going to do is, he's on the back of this ambulance, we'll make sure he's comfortable and then fly him to the LGI.
Pelvic injuries can lead to lethal internal bleeding. Peter's life is in real danger.
So we're going to fly you through to hospital. That's because of the type of injury you've got. We want to take you to a trauma centre for assessment, and that's going to be Leeds. And you know what roads are like down to Leeds, yeah? So it's an easier option. You can get checked over fully there. Yep.
Peter's a well-known figure in the area. He is the 5th generation of his family to be a milkman. A customer has alerted his mum, who has come to the scene. She's naturally concerned.
Mum, dear. Ferry, yeah, she's on her way. Yeah. Okay, love. Just do as you're told, won't you?
The same thing.
He's being carried to the helicopter for his flight. 12 minutes into the heart of Leeds.
Okay, you can pop down bottom end and just feed in.
Right, winch to the left we know about. That's the issue we've got to go there. Got those wires. Okay, 101, we've gone in after there, we've got performance. Alright, you put a grid in for LGI, that's lovely. Bloody jolly.
The team are looking for signs of bleeding, but the pain-killing drugs can affect blood pressure too.
His BP's back now. It was consistent, his BP dropping in relation to the morphine. Yeah. I gave it first 2.5 just to see if it'd have any effect. It went down to 111. That second bolus, it was down to 58.
We're able to tell a lot of things from looking at the monitor. One of them is his respiratory rate, which gives us an idea of how his respiratory function is, and we're looking to see if that goes up or down.
So that's
I can't breathe. He can't breathe.
Nice and steady with breathing if you can. It's nice and steady with that oxygen.
If he said he can't breathe, I'm nervous about the pneumothorax on the right hand side. But currently, his observations are all okay. So sometimes it's important not to do anything until we get down, so I won't do anything unless it's extremely necessary in the back of this helicopter.
Brian suspects Peter has a collapsed lung, a pneumothorax. If he's sat, the level of oxygen in his blood falls further. He may need to operate in mid-air.
97
sat. One thing we'll have to do will be put a needle into Peter's chest on the right-hand side to hopefully let some of the air out that's potentially collapsing his lung. So we're not going to do anything, and hopefully we'll be at the LGI shortly.
Thankfully, the flight is almost over.
NS from 99, we're on finals for LGI.
Okay, he's got the small white cranes coming down to wind, so you can speed back.
Owen is trying to navigate around the many cranes in central Leeds.
Yep, got the 3 yellow ones.
And safely land on the helipad of the LGI.
Right, getting towards the goal, he committed to LEP.
Peter's heading straight to resus.
How are you doing, Peter? We're in hospital now. All of a sudden there's going to be 1 million people prodding your body, okay?
The fight to stabilise their patient is stepping up a gear.
Peter, 56-year-old gentleman, about 12:30 was standing behind his milk float, which then reversed back down a hill over the top of him, and he was found with the milk float down here, and he was lying there.
Peter's very ill and is now in need of life-saving surgery. At Air Ambulance HQ, the team have just finished tea.
Go for a wee, I might have a job if you need a wee. I'm setting you off on it.
Where are we going, Gav? M18.
Pilot Steve and paramedics Gav and Sam are heading to a crash on a motorway near Doncaster with trauma consultant Neil.
We've just been tasked to a motorcycle RTC not far from our airbase in Nostell. The reports have come from a ambulance which has been passing, I believe, on the opposite carriageway and seen the accident and phoned it into our emergency operations centre as an urgent call.
It's happened on a 70-mile-an-hour road connecting the M1 and the M62 Trans-Pennine motorway.
The fact that the motorcyclist has been reported as unconscious suggests that he has a traumatic brain injury, so an injury to his head.
That traffic's been stopped there, look.
Oh yeah, they have. Yeah, they've stopped at the other end.
Right,
Yep.
guys, we're ready to come down this time round, I think.
Police have now closed the motorway, and it's clear for Steve to land.
You're just in front of the police car.
Yeah, that's good there.
The sign's gone.
I'm just going to come left a bit more, because if they reopen that carriageway, I don't want my blades over the... Happy there?
Yeah, tail's clear.
Thank you.
The biker crashed after hitting a huge lump of metal that came off a truck.
Nigel, I'm Neil, I'm one of the doctors. How are you getting on? Open your mouth nice and wide, stick your tongue out. Very good. What hurts? I know you've been asked this.
Shoulder, left shoulder.
Anything else?
Other abrasions.
Okay. I'll have a quick look at you again and then we'll come back and talk to you, Nigel, all right? So he's fractured his left clavicle.
Okay. How old is he?
How old are you, mate?
But many of their questions are going unanswered. Nigel is confused and showing signs of memory loss.
What happened?
You've come off your motorbike. I'm not quite sure of the circumstances at the moment. So his pubic symphysis is aligned, his spines are aligned.
Nigel's been riding down the motorway, and what we've been told is that a large piece of metal has come off a lorry that was travelling in front of him, and he's tried to avoid that piece of metal, which has caused him to come off his motorcycle. If you look at the actual object of metal, it's actually quite large, and if that hit the bike or hit him, it caused quite a lot of damage. So he's lucky really in that respect.
Their patient is a retired traffic cop. Caught out by a freak accident he had no chance of avoiding.
Just wiggle your fingers on this side, give my fingers a squeeze, and that side. Very good. You can feel that, huh?
Yeah.
Okay. Keep your head nice and still. We've got a blanket.
Nigel's rescuers did the right thing and left his helmet on to protect his neck. Now Dr. Neil is going to carefully remove it.
Right, we're just going to ease this helmet off, all right? So just support your head. Let's just see if we can get it off. Keep your head nice and still.
Apart from a broken collarbone, there's no sign of any open wounds. But the team's biggest worry is a head injury sustained through his helmet.
How are you doing, fella? All right? So look, open your eyes.
It's looking like he has severe concussion, at best.
Right, Nigel, put this hand across your chest.
Where am I?
You are on the M18 near Doncaster.
They need to get him to specialist care.
Anybody not happy? Ready, brace, roll. Okay, and down again, thank you very much.
Sam's alerting doctors at Sheffield Northern General.
Jesus 15, up to stable. His blood pressure is 150 systolic. Injuries, he's got some left-sided chest tenderness.
There we go. Okay, sir, all right.
Nigel's injuries are potentially very serious.
What's the last thing you remember?
I'm trying to think.
Okay.
I don't remember anything of the collision.
After 30 years of dealing with accidents, he's now seeing an emergency from a very different perspective.
Very signs at 4 o'clock, Steve. Thank you.
The air ambulance flies more than 300 crash victims every year, and the M18 has once again been brought to a standstill.
We've asked police and highways just before we've lifted to close both directions and the slip road, and then we've lifted safely from scene.
Doncaster radar, hello again, it's element 99 Alpha. We're just lifted from, we're looking to transit the northwestern corner of the zone, VFR, routing direct to Northern General.
It's a 10-minute flight to Sheffield, but Nigel's condition is not improving.
Is any of your memory coming back? Have you remembered what happened?
No idea.
Okay. We'll talk to you again when we land at the hospital after we've done the handover. Okay.
Up front, pilot Steve's eagle eyes are at work.
I can see the helipad. Is it around the nose? It is.
Helimed 99 is touching down at the doors of A&E.
Textbook, Steve.
Nigel's heading for brain scans. It's feared he may have a serious head injury.
There we go, Nigel. We've arrived at the Northern General. So we'll slide you out on the stretcher. And then we'll just do a quick handover to the team.
Dr. Neil works at this hospital when he's not flying.
Slide, ready, set, slide.
He knows that Nigel is in safe hands. It's summer at the seaside, but on the prom in one resort, a life or death emergency is unfolding.
Let's lift. What is it?
Cardiac arrest, mate.
Alright.
Young cardiac arrest. 20-odd.
21?
28, 7,
Oh,
27.
Oh, Jesus, seems so.
Dr. Chris and paramedics Andy and Lee are racing to Bridlington. Seconds count, and the best landing site is out of the question.
Lifeguards have advised the beach is not suitable for landing. Tide is on its way in. There might be somewhere you can land further up, but I'll leave it to you to ready.
Yeah, Roger, take it from that this patient is outside and not inside a property.
Yeah, outside East Riding Leisure Centre, just off the promenade.
We've just been tasked to a cardiac arrest up at Bridlington, so right on the east coast. So that's where their heart stops, their breathing stops. If things don't get any worse than that, and without any action, the patient will die.
I've got a landing site suggested by Coast Guard and crew. It's off Lime Kiln Road, and it's a coach car park. Patient's 25 stone. They're now rocked with spontaneous breathing, ventilated through an eye gel. They've advised 12 leads shows an anterior septal infarct.
Ground paramedics have managed to restart the patient's heart, but his life is still on the line, and his size is against him.
25 stone, maybe this could be a nightmare airway, so we'll draw up drugs on the scene.
So that's the leisure centre directly ahead, just to the left of the big wheel.
Yeah, so that's he's arrested down there somewhere.
Yeah.
Bridlington is packed with summer visitors.
Now I'm just going to do one orbit around there.
All right.
So the ambulances are on the front there, see?
Yeah.
They're on the southern edge of the last ambulance
Well,
there.
it's like they're just rolling stretcher towards ambulance now.
They're putting him in now.
We'll meet him up there then, eh?
So let's go to where we said then.
Yeah.
Okay.
Yeah.
There's nowhere closer to land. Pilot Steve's heading for the coach park.
It looks like you've got Coast Guard and police officers in the coach park. And
Yeah. I've got one stanchion that's below us on the right.
Yeah.
Another one coming up into the 2 o'clock.
Yeah.
I'm going to keep coming forward. I'm going to come right a bit more now.
Yeah. You're good to the left, mate.
Thank you.
There's 98 landing next to Coast Guard station.
The patient's arriving at the same time as the team.
Hi, it's Chris. Hello, you alright? Hello.
Sir, this is a 27-year-old man, I believe was called down.
Yeah.
Basically, was witnessed to start having a seizure.
Yeah.
About 10 to 4.
Daniel Howe collapsed on a family day out, and pool lifeguards started CPR.
So they had a 10-minute downtime from them being on scene to us being. He had one shock with them.
Yeah.
And he had 2 rhythms that were non-shockable. He was in PEA for 1 cycle with us.
Yeah.
Had 1 round of adrenaline at 4:05, and we got a ROSC at 4:10.
Okay, and he's got some cardiac history, is that right?
So he's got, he's had a previous hole in the heart, but that's self-healed when he was younger. He's apparently got a faulty valve, but they're unsure which valve.
Yeah.
And apparently he had a narrowed aorta when he was younger, but apparently that was rectified. He takes no medication, and apparently he's not allergic to anything.
All right, so what we need to do, guys, is get him out, and then what we're going to do is put him off to sleep. Okay.
Daniel's heart could stop again at any moment. Anaesthetising him here gives him the best chance of survival. But there are no guarantees. He's still critically unwell. In a seaside coach park, paramedic Andy is setting up an operating theatre so Dr. Chris and the team can put a critically ill patient into an induced coma.
Right then, are we happy?
Yeah.
So on move, ready, steady, move.
Let's get him set up so it's right underneath him. Have we got any more stuff like that?
Coast Guards are protecting patient Daniel's privacy from passing tourists.
Right, now we're just slow him back slowly, see what it's like.
He owes his life to lifeguards and his auntie, who saw him go down.
We were just out for a family day out. We were just wandering up the promenade, and then we just heard a commotion, and he was on the floor having some sort of seizure. He sort of landed in the recovery position, and he was responding to us and saying he was fine, he was fine, he was fine.
So we're just going to lift the patient, okay? Ready, steady, lift. Thank you.
And then he just seemed to go into some just cardiac arrest, I guess, so we had to get him on his back, and he had stopped breathing.
I know it seems fussy, but getting his position is going to be crucial to sort his airway out.
And then eventually the ambulance came, so they had to give him compressions and just worked on him with CPR for quite a while, really. And yeah, now we are.
Okay. Right, guys, so what we're going to do now is just a quick checklist, and then we're going to get this guy off to sleep, okay? So this is an emergency anaesthetic in the street. It is a bit risky, but it's what he needs, okay? So, ready, good to go?
Dr. Chris and the team will first sedate Daniel, then take over his breathing.
So, Lee, he's probably at 150 kilos.
His size means he'll need bigger drug doses, and putting a tube down his windpipe could be very difficult.
So team brief is this guy is pretty big, so he's going to be a difficult airway. So plan A is going to be to intubate him. Plan B will be to go back to this eye gel and then do something different for the second attempt. Plan C will be front of neck access, which I can feel, but he is big. Okay, everyone happy with that? Should we get started?
Yes, checklist complete.
So silence unless it's a safety thing, please.
Yeah.
Okay.
Fentanyl's going, Chris.
Okay, fentanyl's going in. So all but 1 mil, good. Yeah. And are you going to time a minute for us?
This is a complex procedure. Daniel's life is in their hands now.
Okay, so the patient is going to stop breathing and become flat unconscious. That is supposed to happen, okay? Okay, so that's a 99.
That's 1 minute.
Okay, fingers on for me, if you can, please, Lee. Scope right into my hand, please. Lots and lots of secretions. I've got a big epiglottis. I've got a grade 2 view. Bougie, please.
It's time to slide the tube into his airway.
Can you keep down? We sat somebody.
Yeah, 99.
I can feel the clicks.
I've got the bougie.
I have the tube. Tube's going down. A little rotation through. 22. Bougie out, please.
Bougie coming out.
Cuffs up. Slats are still 99. So chest is going up and down. I've got CO2. You have to have a quick listen, Lee. Okay, you can stand easy and talk as you do now.
Daniel needs cardiac specialists to identify the cause of his arrest. Lee is talking to the nearest heart unit in Hull.
Originally, ECG was quite indicative of an ST elevation MI. That was done at 16, 17, but his subsequent ECGs don't really demonstrate it. So it could be he's just got some underlying abnormalities with his conduction through his heart, and obviously with his previous, it would sort of tie in.
So hands on the scoop, lifting, so we can feed him down.
Keep pushing.
Can you give her 1 mil of that?
Daniel's condition is critical. The team will be monitoring his heart function throughout the flight.
So, just a quick brief. So, numbers-wise, airways, we're happy with this tube, it's secure. The cuff, we've checked the pressure, we've suctioned the tube, we've checked the circuit, and we're happy with that.
Okay, mate.
Cardiovascularly, he's stable, blood pressure's fine with a bit of a tremolo. Right, happy for me to start? Yes, yes.
It's a 30-mile flight south to Hull and the nearest cardiac unit.
We'll go along the grass so that if we have an event, we can actually put it down there. So it sounds like this chap's had a cardiac arrest on the street of Bridlington. We don't really know why. He's got some bit of cardiac history, but that's many years ago. He's a really big guy, so he does have some risk factors for having kind of ischemic heart disease. When we arrived, he wasn't breathing very well, he was unconscious, so we've decided to give him an anaesthetic, which I must say was a riskier thing to do because of his size and obesity. The risk is that you can struggle to get a tube in. However, we took lots of care to prepare that correctly, and fortunately, because of that preparation, it was straightforward. So we're just getting him in now to Castle Hill, which is a cardiac centre for this region, and we should be there in about 5 minutes.
Daniel's survival is in real doubt. His collapse at such a young age is a mystery. Every year, the Air Ambulance team fly to Germany for a grueling workout in a flight simulator.
You got to bring your height up now, mate, to whatever height you need.
To keep them on their toes, training captain Gary confronts them with a pilot's worst nightmare: double engine failure.
Engine 1 fail. Engine 2 fail.
It can be quite tricky. So today they were flying in IMC, so they're flying in cloud, so they've got no reference to the ground, so they concentrate on the instruments of the aircraft all the time. That's high workload. They're talking to air traffic, trying to get things right with the air traffic, making sure the aircraft's pointing in the right direction. And then coupled with an engine failure and fuel leaks and fuel pressure problems, it can get quite hard for the training pilots in the aircraft.
Chief Pilot Steve is just back and now in a real cockpit.
Okay, free takeoffs.
Both to fly.
Fly, both guided.
With real passengers, Tyrone, Al and Dr. Jez.
We'll just lift and go over the top of the building. I just want to let you know now that when I was at the sim, I crashed it 3 times.
Why did you say that? Why did you say that? Just as you took off the end of the shift.
He failed the switch, so I couldn't turn the engine off. He then disabled the over-limit protection on the engine, and then he'd failed the drive shaft on that engine as well. I had a really bad moment.
It sounds a bit ridiculous, that.
Today's medical emergency is deadly serious.
We're going down to Hathersage, which is in the Peak District. A request from our colleagues in East Midlands. I believe there's a HEMS paramedic on scene with a patient, motorcyclist, been involved in a collision. We haven't got a lot of information at the moment, but it sounds like the blood pressure's low, which is a sign of usually significant bleeding or some major chest problem.
The Peak District is the UK's busiest national park. The nearest major hospitals are in Sheffield and Manchester, a long drive in summer.
So it's down towards Hathersage, isn't it?
Yeah, so if it's where I'm thinking of, it's Surprise View Car Park. Roger. Yeah, this is it.
This is it here now.
This is the one.
DCA visual?
Yeah, DCA visual. Alright, let's just slow everything down. Oh, I think we'll have the car park this end, shall we?
That square.
Yeah.
Steve's aiming to land in one of the park's most famous beauty spots.
There's a car coming from the right, so we're just going to hold off until the car's gone past.
The car about 30 seconds away behind us now.
Yeah, roger. Patient's on the ground behind that vehicle.
It's just a motorbike there.
Yeah. Just going to turn the tail. There we go, we should be fine there now.
Yeah, you're okay, tail's clear of that back kid.
There we go.
Okay, we're on.
The biker collided with the BMW. An off-duty paramedic stopped to help.
This is Michael, 58-year-old gent, riding his solo motorcycle towards Sheffield.
IT manager Mike Wells was thrown into the road.
He's T-boned a car at the entrance to the car park. We're not sure how fast he was going, but I suspect probably 40, 50 miles an hour. Okay. And initially he's up and walking about, chatting away. However, he's then had a bit of a hypotensive episode with a systolic of 74 and then a sustained low blood pressure of less than 80 systolic. He's got some swelling over this area of his back, and it's quite painful to palpate from the front as well. So I do wonder whether he's torn something in there and he's bleeding. He's had TXA from us, he's had some paracetamol, and he's had the 250 fluid.
Dr. Jez is concerned Mike may have a serious internal injury. The wreckage could give him a clue.
Yeah, it's fairly substantial, isn't it? It's kind of more of a kind of a side glance, isn't it?
It doesn't help explain Mike's mysterious loss of blood pressure. Only a scan in hospital can solve the mystery.
Michael, are you all right for pain at the moment?
Yeah, I'm fine.
Yeah, for pain relief, sorry. Because you're quite tender around there, we just want to rule out any internal bleeding and stuff.
He has a lot of pain in his abdomen.
It's difficult when you've got the petrol tank there and any sort of injury to your lower tummy. Right, is that what we normally do? Steady, lift.
The roads of the Peak District are notorious for heavy traffic, but Mike will be flying over the jams, direct to the major trauma centre in Sheffield.
Then do we push in here, Jess? Right, push.
Tyrone will be monitoring his condition in flight.
You didn't feel dizzy before you come off your bike, did you? Before you had an impact? You can move your head and neck and everything.
Yeah. Just going to put these over your ears. It gets a bit loud, so okay.
Sure it does.
I've got to come up a little bit because there's a bank behind us.
Yeah, we're clear of the back now.
Thank you. Right, coming up and back now.
Pilot Steve will have their patient in the Northern General Hospital in less than 10 minutes.
Get the nose round a little bit. I'm still pointing at the side. That'll do there. And transition.
99's lifted route in Northern General.
Turning right.
Where's your surprise view?
Yeah.
When the paramedic from EMAS arrived, he was up and about walking around, and then became quite unwell about half an hour with a very low blood pressure, which stayed low for quite some time. And obviously with that mechanism, your concern is he bleeding somewhere? He's had some treatment to try and reduce further bleeding called TXA, and we're just popping him down to the Northern General. We'll probably get a scan to see what's going on.
Pre-landers, please, Al.
Okay, pre-landing checks, doors and harnesses.
Close, secure on the right.
Hold at the back. Radios and lights.
Radios, so we'll clear with Doncaster now. Landing light is on. And we'll just do a 180 round to the left onto the pad.
The hospital scanner is being made ready for Mike's arrival. If he does have an internal bleed, it will detect it.
ADS spinals, Northern General.
Okay, and there we go, LDP. All looking good. And landing on.
If he does have an internal injury, Mike could face immediate surgery.
MMI and lowering.
His outlook is uncertain.
Okay, close it down.
The Yorkshire Dales are home to 20,000 people, spread across 850 square miles of rolling countryside. Many are elderly. All are a long way from a major hospital. Today at RAF Topcliffe, Helimed 99 is being scrambled to back up ground units heading for a patient suffering a stroke in Wensleydale.
Breathe.
Mate, we'll depart out of here. That's the best way, and then out towards the west.
It's a 20-mile flight.
Just hard discretion, that'll be VFR outbound to the west, Helimed 99 Alpha.
Okay, clear to the right in my climb. So we go towards the high ground in the 12 o'clock. Cloud base doesn't seem to be too much of an issue.
A response car is on its way to the scene, driven by one of the Dales' own team of paramedics.
Is there a crew there?
And Pete Shelburne on his way, I don't know if he's got there yet.
He should be there, yeah. I just wondered if there was an ambulance.
Ant and Lisa will fly the man to a specialist stroke unit.
We've been asked to go and look at a 90-year-old person that's got symptoms suggestive of a stroke. But obviously time is patient outcome with anything like this, so the sooner you can get them to the most appropriate hospital, the sooner they can start the most appropriate treatment.
The patient lives outside the market town of Leyburn. The sat-nav is guiding them to his home.
Okay, so I've got a mile to run, as per the grid.
Where the road sort of bends like a boomerang is where the pin is.
Oh, I've got it. I've got an RRV, I think.
I'll go where the trampoline is, mate.
Cool.
Pilot Lee is looking for a safe place to land.
Try to get those trees there, mate.
We're kind of directly over them at the moment.
Yeah.
There are a lot of hazards in his way.
So maintain a set of wires there as well, buddy.
Yeah.
So let's keep off them. Yeah, I just want to get into the ground cushion, mate. Tail's clear right, nose coming left. We're going to come down on that, I think.
Yeah, for a hard trim.
Yeah, tail's good.
Yeah, that's fine. All trim's fine.
It's less than 20 minutes since the patient's family dialed 999.
What do we call you, Derek or John?
Derek.
Derek, right.
Derek. Onset 12:30, witnessed facial droop left side and left-sided arm numbness and loss of power.
Okay.
Dale's paramedic Pete Shaw has already run some tests.
So, Derek, you're having a bad day, are you? Has he still got symptoms now, Pete?
Yeah.
His symptoms are unmistakable.
Just stay with me, Derek. Does it still feel weak?
Yes, it's
squeeze tight.
No,
he hasn't got any grip on the left.
No grip at all.
No.
Right. Right then, shall we put you in our helicopter and fly you to Middlesbrough? Does that sound like a plan?
Yes.
This time you get a nice little flight in a helicopter, look at the countryside.
Aye. He's got what we call fast positive symptoms, which basically when you're having a stroke, we ask people to assess the face, arms, speech, and then test all three. Sometimes patients might present with a headache or loss of vision as well. Derek, since 12:30 this morning, has noticed a left arm weakness, slurred speech, and a left facial droop. His family picked up on it, which isn't normal for him. So it'd be an hour's drive to James Cook from here. So we're going to whiz him in the aircraft up to James Cook. Hopefully it'll take less than 20 minutes.
Derek's on his way to a specialist stroke unit in Teesside.
Nice slow
His son and daughter are concerned.
We'll be there when you get there.
We can take one of you two guys.
I'll go with him.
Right.
Then I'm coming with you, so that's all right. Yeah. Right?
In the Dales, the air ambulances are everyday lifesavers.
It might go straight to A&E or it might go straight to Ward 28. But just head to a main reception somewhere and they'll point you in the right direction.
Thank you.
All right,
Thank you.
Bye.
Right, I'll just lift into the hover and then it'll be a vertical into the 12 o'clock. Got a tours degrade. Happy to continue. Continuing up.
Derek's lived in the Dales all his life. Now he's heading to the Regional Trauma Centre, 30 miles away.
Air desk from 99, we've lifted from scene and we are route to James Cook.
Getting to nearest stroke centre where they manage stroke symptoms would take about an hour and 15 minutes by road. So that's a long time, and time affects patient outcome in these circumstances. We can be at James Cook within 15-20 minutes, and if we've got a tailwind, much quicker than that. So obviously that speaks for itself, the time benefit that it can bring to this patient and his outcome.
135 mile an hour. Not too bad, is it?
It's a big shock for the family. Derek's always been fit for his age.
Okay, just bring the speed off, going to be to second now.
In the next hour, doctors will assess Derek for the most advanced treatment for strokes.
You.
He may be given drug therapy to dissolve the blockage in his brain, but the stroke could leave him with permanent disabilities. The Yorkshire Dales National Park contains 1,600 miles of footpaths through rugged countryside, and when there's an accident, help can be a long time coming. But not today.
Yeah, I'm just going to send you a detail, mate. It's star-botted, it's skipped. It's on the footbridge near the farm, just over the River Wharf.
Helimed 99 is being diverted from a transit flight, and the team are just 2 minutes from the casualty.
Yeah, we're just going to approach the village of Starbottom. What's the detail, Lieutenant Sam?
55-year-old female, fractured ankle.
A walker has fallen in Upper Wharfdale.
Oh yeah, that lady's sitting down there by the bridge, so I think that's probably her.
Yeah, it looks like it, doesn't it?
Got a few rocks on the ground. Yeah, I'm not going to go that much closer. I'm just going to come right a bit where it's fairly clear.
Pilot Harry's touching down on a riverbank.
Okay, leave us down and clear to our strap.
It's a popular area for ramblers, and their patient was on a walking holiday.
You really don't look comfortable.
Well, twisted off the step.
Off of that one?
Yeah.
Okay.
I felt a crack.
Okay.
And I just went down.
Okay, so it's all around your ankle. Can you feel me touching you there? Does that feel all right?
Yeah, fine.
Yeah? Just going to move your leg out slightly. So there's no pain down there, is there? No pain down that side?
No.
Liz Fleming was out on a camping trip.
Can you bring your toes up a bit towards your leg? Is that hurting when you move your foot?
On the underside, on the
other side.
Where you have
okay, should try and sit you up and get you into a bit more comfortable position.
Yeah.
She fears her ankle is broken.
Move that leg as well, love.
Paramedic Paul's not so sure.
So it's swollen a little bit around your ankle bone there. All right, but other than that, it doesn't look too bad. You can move it a little bit that way, can't you?
Yeah.
Okay, how far can you push it? Okay, I think you've just possibly sprained your ankle. I know you said you hear the click and the crunch, but obviously, bearing in mind, you've obviously got two bones that run down there, and you've got all your bones, and obviously it's just attached a joint. So if you've sprained it, you can hear a bit of a crunching sometimes.
Liz was walking back from the pub, but she'd only had a Coke.
Now, we could fly you to hospital, but obviously the thing is the ambulance service is quite busy. We've been a weekend, and this area doesn't have a lot of resources anyway. So it's trying to work out the best way of getting you to your van to drive to hospital for an X-ray.
Liz is in pain, but she doesn't qualify for a flight in an air ambulance.
I'm so mad at myself. I just came down, slipped off this stone step, heard a crack, felt a crack, so hopefully it'll be okay once these painkillers kick in.
Paul has a plan for getting Liz to hospital.
This area is common for walkers and people riding bikes, and Mountain Rescue obviously are aware of the incident, and they've asked if they can come and offer any assistance to us, so they'll come and give us an hand to carry a patient to the roadside.
Hey mate, this is Elizabeth, she's got an isolated ankle injury. Oh yeah.
Yeah, because I mean, what I want to do first of all is see if she'll be able to weight bear on it and walk a couple of steps on her ankle first. Yeah. And as long as we can do that quick movement, and then we'll see what happens. Is that all right with you?
That's absolutely fine.
Mountain Rescue is staffed by local volunteers.
Up with your good leg, that's it.
Here in the Dales, they're a vital backup for the ambulance service.
Do you want to use the bridge then, rather than use that?
Liz is going to be driven to her partner's van.
Gingerly reversing down, so we'll meet it part way up.
He'll be driving her to hospital for x-rays, while Helimed 99 waits for more cases on this busy weekend. Thankfully, the local A&E confirmed what the team suspected. Liz's injury was painful, but minor.
I had an x-ray and then he came back to me and just said, you know, luckily it's not fractured, but you've got serious ligament injury that's going to take quite a while to sort itself out.
It meant it was a long time before she was able to get back to the Dales for a hike.
Probably about 6-7 months, I would say. So quite a long time before it felt stable enough.
But she's very grateful for the rapid response from the air ambulance.
Yeah, even though my injuries weren't severe, just the response and the care was just unbelievable. Yeah, amazing team.
Milkman Peter, who was crushed by his own truck, was found to be bleeding internally. He underwent 4 operations to repair fractures to his pelvis, neck, shoulder and right leg. It was 5 weeks before he was released from hospital, and he was forced to take 9 months off his milk delivering. Ex-cop Nigel suffered a collapsed lung, a torn spleen, and a broken collarbone when he came off his motorcycle after hitting a lump of steel in the road. He spent 5 nights in hospital. Surgeons discovered Daniel, who collapsed with a cardiac arrest on a seaside day out, had a faulty valve in his heart. He underwent surgery, but now he suffers memory loss and can no longer remember training for his job as a supermarket manager. Biker Mike, who collided with a car in the Peak District, escaped with a sprained wrist and severe bruising, and has now bought a new bike. No action was taken against the BMW driver. And 90-year-old Derek spent 6 days in hospital, being treated for a stroke, but he's recovering well and has gone home to the Dales where he's undergoing physio. When lives are on the line,
Are there any obvious injuries?
these men and women will risk theirs
The lad who was driving got blood coming out of his face.
to save yours.
RTC trap.
They deal with the most serious injuries.
The patient is described as bleeding heavily.
Directly below his ear. There's a lot of blood there.
The most critical illnesses.
The reports of a male who's in cardiac arrest, and without any action, the patient will die.
The 2 Yorkshire Air Ambulances cover Britain's biggest county.
He's fallen 30 foot from the roof. Oh yeah. He's got a big cut to his head.
5 million people rely on them
Oh, my leg. All right, sorry, sweetheart.
to deliver cutting-edge emergency medicine
We're just going to go to sleep. He's not looking particularly good.
at high speed.
If you can activate your major hemorrhage protocol.
Every day brings high stakes.
He's gone up in the air about 10 feet, was completely unconscious, but he does look fairly agitated and sleepy.
A bit bullseye at the windscreen, which basically his head's hit it.
He's not screaming out for an hour of sleep, he's right on the cusp. So what we don't want him is to start fighting us in the air,
high risks.
A 65-year-old chap, been playing tennis, appeared to have abnormal breathing, so they've started CPR. They've shocked him once.
Yeah.
If somebody stops breathing, they are classed as clinically dead.
Last time he had an heart attack, he was playing tennis.
And high drama.
A fall from 20 foot is significant for anybody, but especially for a child. Children are more prone to head injuries.
How old are you, Ruby?
10.
You're 10? Can you remember everything that's happened?
Yeah, I was running, and then I didn't realise it was a ledge.
It's rush hour in West Yorkshire, and hundreds of thousands of motorists are crawling home. But in Huddersfield, one of the jams is being caused by a serious accident.
Okay, goggles down on the right.
Helimed 99 is on the way.
Bonjour.
Pilot Scott faces a difficult mission to a busy town centre in pitch darkness.
Helimed 995 on board, lifted from Nostell, routing to Huddersfield. Basic service, please, all main clear controlled airspace.
He's checking in with air traffic controllers at Leeds Bradford Airport, who are in the middle of their own rush hour.
Helimed 99, we'll just clock out in basic service, QNH1012.
Scott's flying paramedics Pete and Al with Dr. Chris to the accident scene, using night vision goggles to see in the dark.
Basic service 1012 is clocking out in Helimed 99.
Reports of a patient who's been struck by a car. At the minute they're quite agitated, so that could be a sign that they've got a severe head injury. Now our concern would be whether they've got a shortage of oxygen, whether their airway's okay. So when we arrive on the scene, we might need to perform an RSI to help to secure their airway and get them to the major trauma centre.
A night mission to a town centre means a high workload for the team.
In the front, Scott and Peter are there wearing their night vision goggles. In the back, we're looking out as well to make sure that there's no hazards. When landing at sea, we're looking for people and also wires, so everyone's going to have their eyes out, making sure that it's safe to land. Blue lights, 2 o'clock low.
Scott must get his medical team as close as possible to the patient, making sure the landing site he chooses is safe. Even the busiest town centres often have open spaces where pilots can put down.
Okay, this is going to be nice and slow and gentle. We are pretty much committed about there. We are into wind. Where are we?
They are joining Dr. Jez, one of their air ambulance colleagues,
I'll be all right.
who volunteers as an emergency critical care consultant in his time off.
I've not seen the car.
But it's allegedly 30, but it's quite quick coming down here. He's gone up in the air about 10 feet, was completely unconscious. He's talking now, he's obeying commands, but he does look fairly agitated and sleepy.
The patient was walking from the pub to a bingo hall.
Just go and have a look at the car, mate, see how much damage he's done. Yeah.
The damage to the car may help diagnose his injuries.
Jez, are you happy if I have a look at him?
The pedestrian's body hit the windscreen. He was then thrown to the pavement.
Oh, this is it, Jez, this one. It's either this one or they've been driving around with a real big chip in the windscreen for a week or two. Yeah.
21-year-old Jordan Porter is very agitated.
Jordan, open your eyes.
He'd only had one drink. This is not the effects of alcohol.
Fair bullseye, that, isn't it?
Yeah. It's a big mechanism.
Yeah, it is a massive mechanism. He's proper smashed the windscreen.
It was right up high in the air.
Maybe even bent the aid post a little bit as well.
Chris is assessing his level on the Glasgow Coma Scale, a measure of consciousness used by medics worldwide.
So currently, eye-opening is to voice, it's a 3, and he just gets that.
Yeah,
verbal response, he's a bit confused, knows his name, so that's a 4. And motor... Jordan, put your tongue out.
The team are considering performing an RSI, putting him into an artificial coma.
I think he's not screaming out for an RSI, but he's right on the cusp.
When people have got a head injury, it can present in different ways. So some people can be completely unconscious, totally unresponsive, eyes won't open, won't speak, won't move. But some people can appear to be quite agitated. They can be quite vocal, telling people to get off them. It's almost like a base response of, your body knows that there's something wrong. So these people, they're not being difficult for the sake of it. They're being difficult because they're actually quite poorly. And it can be a telltale sign.
You're going to feel a sharp
Just relax, buddy. Just relax. All right.
They're trying to give Jordan a drug to prevent internal bleeding.
All right, you're doing really, really well. All right, buddy. All
It's clear flying him like this will be distressing for him and dangerous for the crew.
Let's have a chat with Jez. He's sort of right in the middle. We decided for safety, we will bob him off to sleep.
They're going to anaesthetise Jordan here in the road. It's a risky procedure, but it's been proven to save lives.
His conscious level isn't too bad, but he's just a bit agitated, and if he's going in the helicopter, what we don't want him is to start fighting us in the air at 2,000 feet, so we're going to put him to sleep now and fly him off to LGI.
As soon as Jordan is unconscious, he'll be wheeled to HeliMed 99.
So we'll be doing the procedure out here. We're just getting things all set up, ready to do it, so there's lots of nice bits of room and everything.
Jez is a hospital anaesthetist. Chris is an A&E consultant. Jordan is in the best hands possible.
Gran, that can just go just down there if that's all right.
They're going to sedate their patient, paralyse him, and then intubate him so they can take over his breathing manually.
Right, Jordan. Okay, my name's Chris, I'm the doctor, okay? Because you've got a bang on your head, okay, we need to give you some drugs to put you off to sleep, okay, and put a tube in your mouth. You're not going to know what's going on, all right?
This is a critical procedure, so there's a briefing and a long checklist.
Pre-oxygenation in place with nasal cannula in place.
It is. We've got a non-rebreathe. We're going to go onto the mask. And then
Chris is in charge.
I was going to give him 200 of ketamine and all the rock. Happy with that?
They must prepare for a number of things that can go wrong. Everyone has their role.
OK, so I'm going to be intubating the lead, Al's assisting, Pete's watching, Jezzy's giving my drugs, you're doing mills, you guys just standing back and just keeping an eye. So plan A is the tube, plan B will be the eye gel, plan C will be basic airway, and plan D is to make a hole in the front of his neck. Is everyone happy with that?
The drugs are going in. Jordan is slipping into unconsciousness.
OK, so let's get nice and steady. Laryngoscope, please. Right into my hand. Suction is lurking somewhere. Can you dig out the suction for me, is that all right? The suction, sorry. OK, so I've got a nice view. See his epiglottis.
Now the tube is being slid down his windpipe to ensure his airway remains open.
Let's let Al have a listen.
Jordan's lungs are now being inflated by a ventilator. This procedure could save his life.
Just put this chap off to sleep. When you've got a head injury, it's really important to control the kind of oxygen and the carbon dioxide in your blood, because that can have a detrimental effect if that balance isn't kept just right. Your brain's much more vulnerable when it's been injured. So rather than having somebody that's agitated and fighting and wanting to over-breathe, which reduces the level of carbon dioxide in the blood, once they're asleep, we can just get it just right using the ventilator, which is much sort of better for them. And also, because they're not so agitated, that means the pressure in the head's likely to be reduced.
The race is on to get Jordan to the major trauma centre in Leeds, 20 miles away. Once in the air, it will take just 10 minutes for Jordan to reach the hospital helipad. Safely up, in the cabin, the team's focus is on their patient.
They're always a bit difficult, these head injuries that have had a drink, because it's hard to say how much of it is the drink and how much of it is the head injury. If he was absolutely sober, we'd probably be quite concerned about him. He's had a drink, so we don't really know. So it's very much a case of get him to the hospital, scan his head, see what it shows.
They're nearing Leeds General Infirmary.
I'm going to go back on goggles because I think there's some cranes.
Okay, I'm going to come inside that one.
Right. I've got the cranes, the lights.
Yep. Got them.
Chris is continuing to monitor his patient's condition. He's stable, for now.
Levers all the way down, you're clear to start strapping.
99 landed, LGI.
Jordan is being wheeled down to resus.
Just a quick check of numbers before we go. Ready, steady, move. Keep coming, wait one.
He'll be heading straight to the scanner after a handover from Chris.
On the arrival of ourselves, we were requested because he was agitated. GCS was E3, V4, M6, so that's 13, but he was combative. Decision was made to RSI him.
He's very ill. His injury may turn out to be life-changing.
I'm going to keep my arms nice and straight, and I'm just going to push down. Okay.
You're never too young to learn to save lives.
That's it. 1, 2.
CPR is about to be put on the national curriculum. And training like this is priceless when someone has a heart attack.
Hello. Cardiac arrest 5225. Yeah. Yeah, we're going to go on that. Yeah, I've just seen it now, yeah. Cheers. Bye. Job.
It's early afternoon, and dispatcher Gav is scrambling Helimed 99 to a sports centre in Ilkley.
Right, so that's Ilkley. Cool, alright, pre-takeoffs. Engines both fly. Flight, both guided. Confirmed, doors and harnesses. Close, secure on the right.
We're close and secure here.
Close and secure front, fuel. Check your key, we got 5:30. Validate. Weight-wise is good. And lifting. We'll go out over the wall.
Pilot Steve is flying his medics to a tennis player who has collapsed on the court.
Helimed 99 Alpha 145 helicopter 5QB out of Nostell, inbound to an incident at Ilkley, looking to transit the zone to the south and west of the field, VFR.
Paramedics Matt and Pete are on shift with Dr. Andy.
So just thinking, what's the drive time to go drive from Ilkley? It's about 25 minutes or something? Yeah, I would say so. Was there a rat going, did it, sir?
All I've got so far is had one shock from an EED.
The patient's lucky. A specialist ambulance responder has been called to the incident.
A rat paramedic, red arrest team, which is just kind of the colour that the job was given historically. And essentially these are paramedics who've had extended training in the management of cardiac arrest. Not just the basic life support and then advanced life support, which is the usual things you deliver with shocking patients, managing their airway and drugs to manage the airway. But they have extra pieces of equipment and they have access to other drugs, especially if if their heart starts again. Is that the vehicle just on the entrance of the car park? It's hard to say, isn't it? Nothing's seen.
That was like a tennis club.
Oh yeah, other side.
If the player is still in cardiac arrest, every second is vital.
Okay, I've got a pole down on the left, which is the cable going right across the field I was just aiming for now. So I'm just going to slow everything down. There we go. So I'll put you over by the tree on the right. Yeah, landing now. Yeah, 99, we're just landing.
We just need time for yoga. Oh, good.
Okay, that's good there. On the ground. All settled. Within limits. And you clear out into the 3 o'clock. Okay, 99's landed. Got it, mate. Got it, Pete.
Good, Bob.
The specialist paramedic is working on the patient.
Going through this door, are we? Hello. Where are we?
Miraculously, pensioner Kevin Johnson is conscious.
Afternoon.
After being saved by the club's defibrillator.
65-year-old chap, been playing tennis, about to serve, he's had a collapsing episode. He appeared to have abnormal breathing, so they've started CPR, which is right. They've got an AED, they've shocked him once.
Yeah.
He's come round immediately. GCS of 15 on our arrival, sat up looking in his wallet.
Right.
Kevin owes his life to a first aid trainer taking a class upstairs when he went down.
Yeah.
His history is that he's had an MI before 5 years ago.
Right.
And that's where we're at with it. He didn't have any pain or shortness of breath prior to it.
Right.
But last time he had an heart attack, he was playing tennis.
Dr. Andy wants to know more about Kevin's resuscitation.
Hey, whereabouts is the first aider that came in? Brilliant, well done, good job. So what did it say when you put it on? Obviously it said just shock advised and...
Shock advised.
Is there a screen on it where you can see what it looked like, or is there not a screen on it?
No, it's just basically basic, automatic, shock advised, press the button. Just did one shock. And it did one shock.
And how soon were you with him after he collapsed?
Yeah, it was only a couple of minutes before you were
You came up, I said get the defib, I came down, checked, and by the time I checked his breathing, he was agonal gasping, he was...
Yeah. Could you feel a pulse or...?
Couldn't feel a pulse,
Couldn't.
there was nothing
Okay.
really going on. I was just teaching a 3-day first aid at work course, and we got called downstairs and there was an incident where somebody just had a sudden collapse. People are very reactive rather than proactive, but having those skills initially has potentially saved somebody's life today. Knowing what to do, being quick about it, using the defib and getting your hands on that chest and pressing hard and fast.
The patient suffered a relatively painless heart attack, which is unusual. Pete's trying to identify the cause of Kevin's collapse.
He's got a little bit query elevation. 3s now.
Yeah, looking at his in here, sorry.
Yeah. There's nothing to say there's anything sort of like posterior wall or inferior or right ventricular.
He's still a millimetre.
Yeah, it's not normal, but it's not.
It's obviously
he's not bouncing out.
No.
What is clear is that he's made an amazing recovery.
From a typical CFR perspective, and it sounded really good, and that's probably why they've got a really good outcome.
Yeah. Well, they were on top of it, weren't they? They were there.
Somebody up there having a first aid course.
So he's literally just jumped. He's probably really good.
I didn't know where you were.
No.
We'd have a look at this first, see if we were any benefit of land versus air as usual, and see if there's anything new on there.
He's recovered so well that it looks like he won't need a flight to hospital.
But when he's on there, just do another quick 12, see if there's anything changed in the last 5 minutes, see if there's anything evolving.
He was pain-free when we've spoken to him. Yeah. Kevin? Yeah? Sorry I keep asking you this question, but how do you feel at this moment, other than a little bit sickly from obviously what's occurred?
You said your chest was hurting a bit.
Chest, but not internal pain, as it were, kind of rib hurt rather than...
Yeah.
I'd say, worst case, go to ED. I don't think flying was going to be of any benefit.
He has first aid trainer Paula Coleman to thank for his recovery.
Something is better than nothing at the end of the day, because if somebody stops breathing, they are classed as clinically dead. So if you do nothing, they'll end up staying dead. So doing something is always better than nothing.
LGI are ringing me back. They're just having a word with the consultant. So it could be that we go to LGI, it could be that we go to Airedale. We don't know yet.
I'm so pleased. I can't believe it. We have a success.
Take care, Will do, no problem. Lovely, thank you, cheers, bye. Airedale, guys.
Airedale.
Give you that.
Kevin's off to the local hospital to see cardiac specialists. It's hoped further tests will identify what triggered his second heart attack on the tennis court. The Air Ambulance paramedics never stop learning, and at the Nostell Air Base, they now have access to a state-of-the-art medical simulator.
So Gav, this is a situation. It's a 35-year-old woman. She's been in a big garden. She's been chainsawing some branches. The chainsaw apparently has bounced off a knot in the wood and hit her leg. The situation in there is as you see it. Do you understand? Okay, yep. Well, go, let's go. Yep.
Today, Dr. Tim is putting Gav through some refresher training.
Hello, folks, coming from the Air Ambulance. This is Tim. Oh, my leg. Tim, can you get some direct pressure down? I'll move for it till I get a short bandage.
Compound fractures are difficult to treat. If this patient was real, the team may have only seconds to save her.
So the blood is still seeping out through the bandage, Gav. Okay, I'm going to That's not stopping the bleeding. Pop the caps on, okay. Sorry about this, I'm just going to stop your bleeding.
Doing the right thing when seconds count is an essential part of the job.
Right, Gav, I'm pressing as hard as I can. Okay, you're still bleeding. Really keep pressing down first, Tim. Okay, it's just bleeding out through the bandage. Okay, we'll get this cap on, okay. We'll get that bleeding stopped. I'm just going to go really tight on your leg, love, okay? How's that looking now? That's great, that's not bleeding now.
And difficult, complex emergencies can come in the most unusual places.
Okay, can you hear me?
High above the Yorkshire Dales, the team are returning to base. But dispatcher Lisa has other plans for them.
9A, if you're standing down, can I divert you to Ripon? It's a 10-year-old that's fallen 20 foot over.
Paramedics Lee and Gav, with Dr. Steve, are 5 minutes from the accident scene.
Yeah, that's all received.
The location come through on what 3 words? If anyone's got the app, I can pass you wherever.
Yeah, Roger, we can give me one.
They are using a recently developed location app. that lets members of the public turn grid references into easy-to-remember words.
Yeah, that's from 98. Yeah, Lisa, you know what passes the 3 words over?
Yeah, it's handed, dissolve, carpentry.
It's Bridlington rocks, basically.
So it's called.
We're just heading over towards Ripon to reports of a 10-year-old that's fallen 20 feet. What our control room staff has done is used the What 3 Words app to identify their location. The caller has installed it on their phone, so they've been able to pass the 3-word reference to ambulance control, which has precisely identified their location within a 3 metre by 3 metre square. What 3 Words made a big difference to locating casualties in unusual locations where you may not normally carry a map and compass as you would do if you're out in the hills, but again the location's very hard to determine by looking around you. So What 3 Words has been integrated into many of the ambulance service, police and fire service control rooms, allowing them to locate incidents.
The accident happened at Bridlington Rocks, a popular tourist attraction owned by the National Trust. It appears the child has fallen from a boulder.
Query pelvic and arm injuries over.
Yeah, that's all received. We are showing 3 minutes to the overhead over.
It's a regular destination for the team.
Looking at where it's pinpointed on that What 3 Words, there's a big field right next to it. There is, yeah. Just to the southwest of the location.
Southwest.
But the rocks cover a huge area, and it's never easy to land.
There's some rocks.
Yeah, it should be just right below us here. Right, yeah. Sort of 3 o'clock. I've not seen anything, but it should be.
Pilot Elaine has to avoid hundreds of visitors.
Really want to land where everyone's sitting.
The patch of green to the side of that bush, I know we've landed there a few times before.
Got this little tree on my side.
Yeah, a little bit shrubby.
All good?
Yeah, that's good. Yeah, all good.
Cheers guys, okay.
She's inching Helimed 98 down onto a patch of grass. The rocks make a natural playground for kids, but with some being over 30 feet tall, it comes at a risk.
Hi guys. Hello there.
Oh, Ruby, I told you we'd get some traffic.
Hello there.
See you. Yeah. This is
How are we
Ruby.
doing?
Ruby was up there.
Oh,
She
right.
didn't realise it was a ledge. Ruby didn't realise it was a ledge.
Blimey.
So she came from there straight down to here.
Oh dear. How old are you, Ruby? You're 10. You enjoying some holidays up until now?
Yeah.
Yeah?
Gav needs to identify just how serious her injuries are.
Can you remember everything that's happened?
Yeah, I was running and then I didn't realise it was a ledge and I just couldn't stop.
Hemodynamically.
So you fell, and can you remember how you landed? What did you land on?
Radio pulse 120.
Over there.
Did you land on your feet or did you land on your side?
On my side, like
Yeah?
on this side.
Oh, okay.
There's a chance she could have broken her hip or pelvis. Both can cause internal bleeding.
I'll just give a little feel behind the back of your head. You haven't got any pain behind your head here, and you've got nothing in your wrist down, and your back of your neck down here, no? Nothing at all, no?
Everything's fine except for my hip.
Your hip's what's hurting the most, yeah? Chest all clear, yeah. Okay. Your legs are all good, and you can, it's just the side down here, yeah?
Yeah, like my hip there.
Well, can I have a little look at it? Your wrist.
My wrist that kills so bad.
Your wrist, yeah.
Dr. Steve wants to ease her pain, but it's a frightening experience for a 10-year-old.
Shall we try some of this nose medicine, Ruby? Yeah, we'll go some fentanyl. Yeah, we can. Do you know when you go upside down the swimming pool, you get water up your nose? It's nowhere near as bad as that. All right? You don't take it. It's only a squirt of a spray. Do you? We squirt it and that's it, and it's done.
Dr. Steve doesn't want to stress his young patient, so he comes up with an alternative painkiller.
If you want to try, you want to drink and see how you go, because you seem pretty cool, calm and collected at the moment. So we give you some medicine, put a little soft thing around your hips, and it just keeps them still. Now I'm pretty happy that you've wiggled your feet and done all the right stuff, but they're fine, but it's just as a precaution. We'll put you on a little stretcher, and I'm delighted to see that you're not 18 stone, because then we've got to carry you back up the hill. This is the medicine then, Ruby. It's not very much. Do you want to just drink it quickly and then it's gone?
Once the painkillers have taken effect, they'll move her. Ruby Jean came to the rocks with her mum, dad, her brother, and a friend on a day out.
I think if we just many-handed lift, so a couple on that side, a couple on this side, because she's not dead heavy, lift her up, scoop straight underneath, straight down. Does that sound a reasonable plan to you, Ruby? What we'll do, put our hands underneath you, lift you straight up, onto the stretcher and lay you down on it, okay? Yeah. What I'll do, we'll take this blanket off for now so we can see. Yeah, we can, yeah.
Her wrist has been splintered, but it's vital her pelvis and hip are kept immobile.
Okay, just do a hip. Right. Just this hip, isn't it?
That's
okay.
Right.
Okay.
Right.
Is everybody ready? Yep.
On lift. Ready, steady, lift.
Brilliant.
There you go, Ruby. Brilliant. There we go. That's it.
Pop that.
Fair enough. Brilliant. Yep.
There we go. Perfect.
Right. Put your head back, Ruby.
There we go. There we go, and just gently down.
Down we go.
That's cool.
How's that? That feel all right?
Yeah.
Excellent. Okay. We're going to get a blanket on you now so we keep you warm, all right?
She's going to be flown 15 miles to hospital in Leeds.
Okay, so I think one on each corner. Yeah, one on each corner. We'll have a gentle walk up. Okay. Cool at the top.
On lift. Ready, steady, lift. There we go. How's that?
Well done. Right, we'll just have a gentle little walk, okay?
Dr. Steve wants his patient to be x-rayed. Pelvis fractures are dangerous, especially in children.
Ruby's been really lucky. She's landed on her side. She's broken her wrist, and she's got some pain in her left hip as well. So what we'll do, Ruby, is kind of poke you in through the back door, slide you up on the stretcher. Once you're in, we'll get you some ear defenders on, I think, because it is a bit noisy. She's been really brave though, and she's really cool, calm and collected, so she's helped us kind of evacuate her and carried her up on a stretcher here. But given that she's got some pelvic pain, put a pelvic binder on, we're going to take her up to Leeds General Infirmary, the Paediatric Major Trauma Centre, for a check over there.
It's a 7-minute flight. Not the way Ruby Jean or her family expected their day out to end.
All right, boss.
But Dr. Steve is taking no chances.
A fall for 20 foot is significant for anybody, but especially for a child. Children are more prone to head injuries. They've got a proportionally larger head to the rest of their body. Whilst they're less likely to suffer fractures, their bones are more pliable, they can suffer significant internal injury from such a fall.
Ruby Jean's on final approach to the major trauma centre. Her mum is anxiously awaiting the x-ray results. At Air Ambulance headquarters, dispatcher James is on the radio with a paramedic at a road accident on the Yorkshire coast.
We've got a approximately 55-year-old male come off the motorbike approximately 40 miles an hour. The gentleman has become confused and is repeating questions, doesn't remember the incident.
Memory loss can be a sign of a serious brain injury. It's a mission for Helimed 99 at the North Yorkshire Air Base.
Hello, I've got a job for you. Basically, it's a chap who's come off a motorbike, crew are a bit concerned, his GCS has gone to 14. Are you alright to just go and have a look and give him a bit of an eyeball?
Paramedics Pete and Adi are on the case.
That's from 99.
to Scarborough.
The crew that are on scene with the patient at the moment are clearing that he might have a pelvic fracture and or a femur fracture. So the patient would need to be taken to a major trauma centre, and then if one of them is in Middlesbrough, we can get to Middlesbrough a lot quicker than a road ambulance.
The sun's setting and the light is fading. The biker came off on the main holiday route into Scarborough.
Visual, we got the Rosas closing the road.
Okay, I'll come down, and then I'm going to cross over the road and fly up that side so I can have a look into it without staring into the sun.
Yeah, that sounds like a good idea. Got birds on the lake below us.
Yeah.
Pilot Colin is inching the helicopter down onto the road, which has been closed by police.
GCS 14 throughout?
Yeah, he's
reacting throughout?
very, very repetitive. He hasn't got a clue what's happened to him, which way he was going. Car in front braked heavily.
Sure.
He's hit the front brakes, gone straight over.
Wow. John Ruddock was riding home from work when he crashed. His pelvis may be fractured.
Unfortunately, with a lot of motorbikes, you've got a big fuel tank in the way, and when you go over it, your legs go either side of it, which can cause pelvic injuries. He's got pain in his groin. Based on the mechanism, we're going to fly into James Cook anyway.
Doctors at the major trauma centre in Middlesbrough will be able to use their scanner to check John for a brain injury and x-ray his pelvis.
We're just getting these bits off you so it's a bit easier to look after you. We'll take you to the hospital. Get you sorted out, all right.
Anybody else involved? No, man, it's just me.
John's continuing confusion is worrying. In his case,
Time is of the essence.
Right, I'll ring these, we'll get him loaded on, we'll get him off. I can PRF him on the way.
Cool.
He's a little bit repetitive, so he's probably maybe got some concussion, but it's quite hard to tell without sort of further investigation. He's got some pain in his pelvic area, which might suggest that he has fractured it. So we will treat it like worst case scenario, like he has fractured it, and take him to the major trauma centre.
Where are you taking me?
Middlesbrough.
What happened to my bike?
The police will sort that out.
Have I hit somebody?
No.
I'm on my own?
You are, yeah. And just put this one on your finger. Have you ever been in a helicopter before?
Have I been in a helicopter before? Definitely not this end.
The team are flying John 35 miles across the North York moors.
99, lifted, reach to James Cook.
Received, thank you.
The speed of the helicopter will save at least half an hour. Time that could make all the difference to their patient.
He's not orientated to time and place, he's a little bit confused. The good thing is that that's not got any worse, so hopefully that will just be concussion related. However, it's not been long since he's had the injury, so...
The sun has all but set, but HeliMed 99 is on final approach to the James Cook Hospital. John is heading straight for resus. Tonight's crash could change his life.
There will be an element of shock, that's why I said try and get some blankets to cover her up, but do not move her, okay? Keep her as still as you can for me.
Dispatcher Helen is listening in on a 999 call from stables in South Yorkshire.
Is it a upper or a lower leg that you think is broken? Upper.
Oh, okay. I think I want you on this, if that's all right. She's screaming in pain, this poor lass.
Dr. Chris and paramedics Lee and Andy are scrambling to the scene.
Okay, and away we go.
Pilot Steve will have HeliMed 98 there in 10 minutes.
What's this we're going to? It's a 15-year-old that's fallen off a horse with a femur fracture, sounds like. It sounds like her leg is trapped underneath her and facing backwards away from, so she won't let anyone near it. I don't think I'll let anyone near my leg if it was like that, to be honest. Helen's just asked us to attend an incident in the Stocksbridge area of Sheffield. Reports of a 15-year-old girl who's come off a horse, and the initial concerns are that she may have a fractured femur. So that's the main bone in your thigh. The report is that the leg is kind of twisted behind her, and that she's in lots of pain.
Local paramedics are on their way too.
Dispatch 98.
Receiving, go ahead.
Just let you know, DCA, ETA is 2 minutes. They've updated them that you are en route. They are moving the horses into another field, so there should be none in the field in which the patient is.
Roger that, we're visual with the DCA at the moment and just overhead scene, looking for somewhere to land over.
Steve needs to make sure he doesn't cause another accident.
I'm going to go in this field here because there's no horses.
Helicopter noise can spook animals.
You got wires on your left, wires have just gone over to the left there.
You look good back here, Steve.
It's a very low sort of string fence.
Understood, yeah.
The team are first on scene.
I'm just going to park you this way because of the slope. Very slope. Yeah. Alright, and landing on. Okay, that's all good within limits. Alright.
Lee and Chris are heading out to assess the patient.
Hello. Hello. All right, you do well there. Yeah?
15-year-old Emily was exercising her horse. Her dad is with her.
So, Ellen, just in your own words, just talk us through what happened then.
I fell off and I think I landed on my leg.
Okay. When you say you fell off, what were you going over a jump or were you just sort of cantering?
She just booked, I think.
Did she?
It's a very bad break.
So I can see you got body armour on, you got a helmet.
Yeah, it was on.
Were you knocked out at all?
They'll have to straighten her leg urgently to prevent shards of bone puncturing blood vessels.
I know can you wiggle your toes in your foot? You can feel your foot. Does it feel okay?
Even moving the blanket hurts.
So we're going to we're going to give you some gas and air. Okay, this is what they give to ladies during childbirth. So it's got a good track record, okay?
So just keep nice deep breaths on it. You got it?
The team have ruled out other injuries, but until her leg is straight, Emily is vulnerable to internal bleeding.
Right, Emily, you're going to feel a sharp scratch in your back of your hand.
Let's get your pain a bit better before we...
Just open and close your hand a little bit more for me. Like grabbing for money. There we are.
A bit funny. You'll be doing that when you're older.
So you can feel a sharp scratch on the back of your hand, Emily, okay?
They must work quickly.
Right, so he's got a little plastic tube in your back of your hand now, so it's going to secure it, Emily, okay? Just because one second we don't want stuff to lose it.
That's ketamine in there, 10 milligrams per mil.
Cheers, mate.
Okay.
What we're going to do, because you're quite a considerable pain, we're going to give you a drug called ketamine, okay? It's a really, really potent analgesia, okay? It'll make you feel a little bit strange, a little bit like you're floating away, a bit out of body sort of thing. You might sort of cry out and moan a little bit, but you won't remember anything, okay? Because what we need to do, we need to put your leg into a splint. So we have to pull it back to its normal length and then sort of strap it together, okay? All right.
Emily is slowly being sedated.
It's nice, slowly breathing down, Emily, nice. That's it. The feel, yeah? Should start slowly trying to make some actions. I can give it a bit more. It's all right. So she's in a good place at the moment, so... Okay, she's still in a good place, guys.
The drug is working well. Without it, she would not be able to bear them moving her broken leg.
How are you doing, Emily? Yeah?
Use it to length. You want to pull the other one in close. Good work, good man. That looks pretty good, mate.
Yeah.
Fair enough. Numbers are fine. Should we get a move in there?
Yeah, so let's get into the scoop.
Her leg is now in traction. It's been a textbook operation.
Right, Dad. What I'm going to do is I'm just going to take a head from here. We can just slide you out.
You slide out, Dad.
Just keep nice and still for me, lovey.
She's been a really good patient. Clearly in a lot of pain when we initially got here. Very settled, happy, as long as she wasn't moved or touched and stuff like that. It's clearly evidently quite a sort of quite dramatic injury really, that needed doing.
Ready, steady, lift.
We opted to go for some strong analgesia straight away. Ketamine in these instances has got a sort of proven track record of providing really good sort of analgesia and sort of slight anaesthesia, so the patient hopefully won't remember the events that have just happened.
Okay, ready, steady, lift. Right, so we're going to take you down to Sheffield, okay? To the Children's Hospital.
Hello, it's Leo, Helibed 98. Yeah, I got a 15-year-old girl, fallen from a horse. Yeah. She's got an isolated left femur fracture.
Just keep the patient nice and high. Keep coming, keep coming.
Initial pain score was 10 out of 10 when we got on scene. It was really angulated and deformed. She's had 20 milligrams of IV ketamine to straighten it, and she's been stable throughout. She's now packaged in the back of the airframe. We're going to be with you guys in the next 10-15.
Yeah,
Emily is now reasonably comfortable with the ketamine, but the team still need to keep a close eye on her.
Okay, mate.
Her leg will almost certainly require surgery.
How's your pain? You like end stocks, don't you? It's your friend, isn't it? Yeah. Has my colleague told you about the helicopter flight? Yeah, that's all right. So you're literally going to be in a helicopter in about 5 minutes.
Okay, everybody happy to start?
Yeah, we're all good in the back.
AQ's clear on the right, they're clear on the left, no horses.
This wasn't the ideal landing site for Steve.
Bless you, Steve. Horses, I'm allergic to them. Right, okay, intention is to lift, and we're departing into the 12 o'clock. There we go, we've lost the fuel reserve caption, so that's good. Just moving forward and right, away from the wires.
98 lifted, heading Sheffield Children's.
Emily is now quite comfortable.
Ketamine works really well as a painkiller, particularly when you need to manipulate joints. One of the drawbacks with it though is if people are quite agitated before you give it, then often that can get worse. But she's done really well with the ketamine and the Entonox. We've got her legs straight, and now we're on the way to hospital.
Steve's heading into the middle of Sheffield.
So Northern General's down there on the left. Alrighty, visual of the landing site.
98, we're preparing to land over.
They're touching down in a park that doubles as a helipad for the Children's Hospital.
There we go, that's a good position. And landing on.
98, we've landed Sheffield Children's.
Emily's completing the rest of her journey by trolley. Her dad's driving to join her in Resus. The following day, Emily spends 4.5 hours in surgery as specialists repair her shattered thigh bone with pins and plates. It's the start of 10 days in the Children's Hospital, followed by several weeks in a wheelchair. But she's determined to ride again.
You've shocked him once.
Yeah.
He's come round immediately.
Tennis player Kevin, who collapsed on the court with a cardiac arrest, underwent a quadruple heart bypass and is now fully recovered. By coincidence, the club's defibrillator saved another player just 10 days later.
Can you remember everything that's happened?
Yeah, I was running and then I didn't realise it was a ledge.
Ruby Jean, the girl who fell from Brimham Rocks, fractured her pelvis and broke her left wrist. She was released from hospital after 48 hours, but was in plaster for 8 weeks.
Have I hit somebody?
No.
I'm on my own.
You are, yeah. Let me just put this one on your finger.
Biker John escaped with severe bruising and concussion, but he can't remember 7 hours of the day he crashed.
I was going to give him 200 of ketamine, or basically all what's left, and all the rock. Happy with that?
And Jordan, the pedestrian knocked down in Huddersfield, was lucky to survive. He spent 17 days in Leeds General Infirmary, as doctors treated 3 brain bleeds caused by the impact, which fractured his skull.
I can't taste, I can't smell. That's probably the worst. I'm sat at home thinking, well, it doesn't really matter what I eat. Like a Brussels sprout's the same as a roast potato, innit?
He's now deaf in one ear and prone to seizures.
The doctor said that you've got 5% of your smell and taste. So I've done research on it, and it says if you don't get it back within 6 to 12 months, it's probably not going to come back, which is not good news, but I'm still living. I'm lucky to be alive, to be honest. I'd like to enjoy a kebab or something. Rather have your life than your smell and taste, surely.